I think some people think we're all crazy.
I would, not be able to keep a job, not be able to take care of myself, do normal things.
My marriage was completely destroyed over it, everything.
Somebody would say something to me and I wouldn't say anything back because I wasn't sure that this person was talking to me. I didn't know whether it was the voices speaking to me or it was real.
I've been hospitalized about 4 times.
It's permanent. You can't get rid of it. So it was something that I would have to get used to. Something I have to get used to.
Try to imagine a life where you cannot tell what is real. Everyone you meet seems hostile and out to get you. Carrying on a conversation is overwhelming and confusing. Friends and loved ones are increasingly alienated by your strange behavior. Keeping a steady job is nearly impossible. You seek refuge in drugs and alcohol to quiet the voices in your head. If you're lucky, you get good treatment and medication. But maybe the medication causes a reaction, or you can't remember what to take or when. Maybe you don't think you need it anymore, or it just stops working for you. You begin a cycle of relapse that may last your entire life. Even if you receive effective treatment, your life is never the same. It has been interrupted, and returning to what you had before, what you were before, is a long uphill road. The illness is now a part of you, and your life revolves around keeping it at bay. This is what life is like for many people with schizophrenia. The devastating effects of this disease have been tempered in recent years. New research and understanding of neurochemistry has opened doors for treatment advances. The chance for patients to lead more normal, healthy lives is greater than ever. Yet much about schizophrenia remains elusive for those who study it and those who suffer from it. This program will explore schizophrenia, its causes and its effects on patients and on our society. Schizophrenia affects about 2.2 million Americans. While this is only about 1% of the adult population, the illness has a tremendous impact on our society. People with schizophrenia fill up to 1/3 of all psychiatric hospital beds in the U.S. Perhaps those in the hospital can be considered fortunate. At least they are receiving treatment. Many people with schizophrenia end up on the streets. In fact, it is estimated that 10% of the homeless population suffers from schizophrenia.
My living arrangement was like, I would get money in my pocket. And I would go to a motel and wash my clothes and shower and back on the street again. And the next time I get money, that's what I would do again.
Schizophrenia also has a tremendous economic impact. The National Institute of Mental Health estimates the illness costs the U.S. around $65 billion per year. About 1/3 of that is spent directly on treatment, including inpatient and outpatient therapy, as well as medication. The rest is spent on numerous other factors, such as lost productivity, caregiver time, social services, and criminal justice resources.
I've actually tried to go out there and fill out applications at work. I get frustrated. I wind up just walking out of there and I mean, I hopefully see myself doing work again. I want to get off the Social Security. I don't believe it's really that much of a lifestyle,
Perhaps the most tragic aspect of schizophrenia is its age of onset. Most people are diagnosed between the ages of 17 and 25, when they are just beginning their adult lives. The disease interrupts education, careers, and bright futures.
I'm 19 years old. It all started in my senior year when I was hospitalized.
I'm 61 right now. I got diagnosed when I was about 21 or 22 or 23, somewhere around it.
Contrary to popular belief, schizophrenia has no relationship to multiple personality disorder. While schizophrenia does literally mean split brain, the name actually describes a break between the mind and reality, not a split personality. Schizophrenia was identified as a disorder in 1887 and was officially named in 1911. But even after a century of research, the causes of this disease are still not fully understood. Today, it is widely believed that schizophrenia is caused by a variety of factors working together, which may include a genetic predisposition, structural differences in the brain, chemical imbalances in the brain, and environmental factors before and during birth. Stressful events in a person's life are not believed to be the sole cause of the illness, but do seem to affect its onset and course of symptoms. Schizophrenia is also a neurodegenerative disease, meaning that over time, the condition worsens due to physical damage to the brain. The brain actually loses gray matter. This is not unlike what happens to the heart muscle after a heart attack. Each episode of the illness causes the patient's mental health to decline. The symptoms of schizophrenia can vary, and many overlap with other mental illnesses. Schizophrenia is primarily diagnosed by the presence of what are called positive symptoms. In this case, positive does not mean good, but rather the presence of symptoms that should not be there. These include hallucinations, both visual and auditory. Persons may hear voices or see things that aren't there.
I thought the radio was talking to me, or I thought people on TV were talking to me, and I thought that people could read my thoughts. Thought that they knew what I was thinking, where I was going to be, and when I was going to be in a certain place. I thought people had that over me.
I hear voices. Some are, they're basically negative. They say I'm a loser and I'm no good, and sometimes they tell me to hurt myself. Other times I think about hurting somebody else. But the medication suppresses most of it.
Delusions are another kind of positive symptom. A delusional person believes something that isn't true. They may think others are following them or plotting against them, or they might even imagine themselves to be some other person, such as Jesus Christ. This state often leads to paranoia.
David's symptoms just seemed to explode, in the sense that he became extremely paranoid and that he thought people were watching him, following him.
I thought the police was following me all the time. I even went to the police station in Sacramento and complained.
I remember one night, he was outside of our emergency room, and he was quite psychotic. He believed that the doctors were plotting to cut him open and to put glass within his body. I had to kind of talk him down. I had to talk him into coming into the hospital.
It was like living in a house of horror or something. I was very afraid, scared of people.
Schizophrenia also results in disorganized thinking. A person with these symptoms may carry on a conversation that simply does not make sense.
I wasn't able to process, I had too many ideas coming in all at once. And I think that's part of the disease, part of the way the disease works, is it's kind of just like an overload on information.
When I first saw him in the inpatient unit here at he was extremely disorganized. And every time you go up to him, it would literally take 20 seconds for him to say anything. And a lot of times, things that came out of his mouth made no sense at all.
Negative symptoms refer to normal behaviors and affect that are not present. Frequently, people with schizophrenia will seem emotionally flat and won't seem to enjoy normal activities. They often lack the motivation to do everyday things.
He had more of what we call the negative symptoms of schizophrenia, the isolation and the social anxiety, and he wouldn't go out of the house.
It's just kept me indoors and afraid to live my life, pretty much.
There's 8 people in the house with me, including myself. The people have similar disabilities than I have, that I do. Mainly I stay isolated from the rest of the people. They'll be together, gathering, talking and stuff. I'll kind of be off to the side,
I lost contact with my family my sisters and brothers, nieces and nephews and everything. I left home. I didn't want to have anything to do with them. I didn't want to have anything to do with people. I shut down for about 6 years. I didn't want to be bothered with people.
While positive and negative symptoms may characterize schizophrenia, depressive symptoms are often the most debilitating and overlooked aspect of the disease.
I started noticing that I got even more depressed when my illness came.
I went through major depression for like 3 months. Like, you have a lot of ups and downs. You feel like you're really good inside sometimes, and then you feel really low.
Due to their illness, many people simply withdraw. Sadly, about 10% of people with schizophrenia commit suicide. Many more attempt it.
I embraced the thought of death. I wanted to die, and I thought it was a good thing to do. I've always thought it was a good thing to do, to get rid of this.
I could have killed myself at any time, and it was good for me to be in a hospital because that was the best place for me to be because it kept me from doing any harm to myself.
People with schizophrenia often turn to drugs or alcohol to alleviate their symptoms. Unfortunately, substance abuse can actually make symptoms worse. Drugs and alcohol may also interfere with the effectiveness of psychiatric medication, further complicating the illness. People with schizophrenia are about 3 times more likely to smoke and have a higher incidence of certain comorbid medical conditions, including diabetes. All of this increases the social and economic burden of the disease.
Yeah, if a person with schizophrenia drinks, that's the hardest part. That's the hard, because you get temporary relief there. And this is what you look forward for. This is your day right there. All day drinking, every day. And I really got into really bad health, drinking and not eating or whatever.
While a person with schizophrenia is unlikely to inflict harm on someone else, in rare cases, violent delusions and psychotic episodes can turn deadly. These tragedies inevitably draw media attention and tend to perpetuate the stigma that people with schizophrenia are dangerous. What these cases really illustrate is the continued lack of consistent treatment for many people with schizophrenia. Thanks to increased research in the fields of neuroscience and mental health, schizophrenia is now a more manageable illness. Medications primarily work by rebalancing the chemicals in the brain. Different medications have different effects and different side effects. Some side effects may be so intolerable, patients refuse to take the medication. This leads to a cycle of relapse that continually worsens the patient's condition.
I often wonder if I can ever, quote unquote, go back to normal, and not rely on pills. But I know through therapy and work with the doctors that that's just absolutely not possible. I have to take the pills.
Finding the right treatment and keeping a patient on it is key to helping a person with schizophrenia lead a full and productive life. Indeed, with the array of effective treatments available today, many people with schizophrenia can live normal lives and resume relationships with friends and family.
I haven't been in hospital for like 9 months to almost a year now.
In fact, now instead of saying, just take your time, you don't have to rush in a job, I'm going, Thomas, it's time to go out and start looking for a job. It's time to start going back to school, As far as things we do together, like fishing and stuff like that, now it's pretty much the same as it was before. He's still trying to fish better than me.
You try one medication and then you try another and you find the one that works best for you. So it's kind of difficult, like that period of time. But once you find medication that works pretty well with your body and your chemistry, it's pretty good. It's not too bad.
I visit my family every year. We're all back together now, and we're in contact about every other day. I talk to one of my sisters, my niece and nephews, and whatever. And we make sure our conversation ends with "I love you," and "I want to see you. Please come home." Yeah, and that makes me feel great.
There is no cure for schizophrenia. Today, hope lies in continued research to better understand this illness and the utilization of effective treatment to improve the lives of patients, to reduce the stigma of the disease, and to integrate people with schizophrenia into society. After all, their goal is simply to live a life no different from anyone else.
I want to get out and meet new people and, experience new things.
I'm hoping that at some point that he will be able to continue some education and be self-supportive and hopefully, go on, have a family, and I think everything that a parent would want for their child.
Just like our group, everybody in there, at first you could tell they had an illness, but after they've been taking their medicine and following the right steps and taking care of themselves and following through the right plans, they all improved. Everybody in my group is doing really well now. They live normal lives and you can't really tell they even have an illness.
The main thing about this disease is you learn more about it as time goes on, and you learn to manage things differently. So, I don't know, I think it'll always get a little bit better,
When I asked him recently, what do you're doing so well, Jason, what do you want beyond this? And I want to continue to improve. I want to gain back all the years I have lost because of this, and I'm going to fight this.
I always have hope. A hope that our patients can lead a life not because of their illness, but actually in spite of it.